San Francisco, 21 people on board a cruise ship off the coast of California have tested positive for the coronavirus, Vice President Mike Pence announced on Friday evening, a significant escalation in the spread of the virus on the West Coast.
Of the 21 people who tested positive, 19 were crew members and 2 were passengers, the vice president said, announcing that the ship, with more than 3,500 people on board, would be brought to a non-commercial port this weekend.
"We will be testing everyone on the ship," he said. "We will be quarantining as necessary."
The developments on Friday intensified the focus on California, where residents were confronting an alarming new reality. From the gold country of the Sierra foothills to the sprawl of Los Angeles, America's most populous state was emerging as a new center for the virus.
As of Friday afternoon, California had more than 70 confirmed cases, not counting the cases on the ship.
Off the coast, thousands of cruise ship passengers, many of them Californians, had been holed up in their cabins all day under isolation orders as they awaited news of whether the coronavirus may be festering on board. On Friday night, those travelers were learning they would be brought to an unidentified site for testing and possible quarantine.
"We are working literally hour by hour with the Department of Defense and the state of California to identify the military bases where we will do the testing of the remaining passengers," Mr. Pence said.
The panic over the fate of the ship, the Grand Princess, which was returning from Hawaii, began this week after a 71-year-old man died after traveling on a previous leg of the cruise, a round trip from San Francisco to Mexico last month. Another passenger from that leg of the trip also tested positive for the virus and is being treated in California.
Then, more cases with links to the ship emerged on Friday. In Placer County, northeast of San Francisco, officials announced 3 new cases, all passengers who had previously traveled on the Grand Princess on a trip to Mexico. Nearby in Contra Costa County, officials also announced 3 new coronavirus cases, including 2 who had been aboard the Grand Princess.
Dr. Deborah L. Birx, the White House's coronavirus response coordinator, said that many cruise ship travelers were in their 60s, 70s, and 80s, a group that may be more vulnerable to the virus.
Shortly after Mr. Pence's briefing, the ship captain came over the loudspeaker and apologized to passengers that they were getting updates from television news, rather than him. The captain said that he had not received any advance notice about the news briefing and that the ship would notify individuals of their test results as soon as possible.
"We are working to make you as comfortable as possible," he said.
Patricia DiMartino, whose relatives are passengers on the ship, said her 82-year-old brother-in-law had a fever and a cough, but his test results came back negative. "Even if he doesn't have coronavirus, he's got something, and he isn't seeing a doctor," she said, adding, "This is a fiasco." Her brother-in-law and sister said they were told to order a week's worth of prescription medication.
The Grand Princess is owned by Princess Cruises, the same company that runs the Diamond Princess, the coronavirus-stricken cruise ship that was quarantined off the coast of Japan last month. The virus circulated among the more than 3,700 crew members and passengers who were waiting out a 2-week isolation period in the port city of Yokohama, with more than 700 cases identified from that ship. In a statement, the cruise line said it had simultaneously learned of the 21 confirmed cases from Mr. Pence's news conference and from Centers for Disease Control and Prevention officials, who told the doctor on board. Patients were being informed of their results on Friday evening. Separately, a somber statement from the chief health officer of San Mateo County, in Silicon Valley, underscored a feeling that was gaining traction across California, that the coronavirus had most likely been spreading in the community for weeks and had the potential to morph into a severe pandemic. "It is important to recognize how difficult the times ahead may be and how you must now take assertive action to prepare for them," said Dr. Scott Morrow, the health officer, urging people to stop shaking hands, stock up on medications and cancel all non-essential gatherings. "How the world operates during a pandemic is different from how the world operates normally," he added. "This is not business as usual." In the Bay Area, the engine of the country's technology industry, officials have now confirmed cases to the north, south and east of San Francisco, reinforcing a feeling that the virus was closing in on the region.
In the city itself, where 2 cases were confirmed on Thursday, the Department of Emergency Management, housed in a 2-story earthquake-resistant building, was operating at its highest level of preparedness. Workers translated warnings to residents into Chinese, Spanish and a half-dozen other languages.
In Los Angeles County, the public health director announced 2 new cases on Friday, bringing the total for the nation's most populous county to 13. The total includes 2 people who worked as screeners at Los Angeles International Airport. Los Angeles officials said the city's marathon will go on as planned on Sunday, although officials urged runners coming from countries affected by the virus to reconsider participating.
3 students at the University of California, Los Angeles, were being tested for the virus and isolating themselves off campus.
The virus also seemed to be spreading in rural areas. Officials in Yolo County, an agricultural area in the Sacramento Valley, announced their first case on Friday. The patient was an older woman with underlying health conditions who is believed to have contracted the disease from someone else in the community, county officials said in a statement.
As the number of cases grew, so did fears for the safety of emergency medical workers and members of the medical staff.
Those worries were crystallized after an incident in Sunnyvale in neighboring Santa Clara County, where police officers on Thursday performed CPR on a man who was potentially infected with coronavirus and had recently returned from the cruise ship now stuck off the coast. The man was declared dead and 7 officers who responded to the call were placed in quarantine and then sent home.
I want to express the importance of everyone remaining calm, Fan Go, the chief of the Sunnyvale Department of Public Safety, told reporters.
At the same time, adding to the anxiety spreading across the state, there is growing concern that California health facilities are ill-equipped to deal with the virus, and do not have enough testing kits to handle the growing number of cases.
A nurse who is being quarantined in Northern California issued an anonymous statement on Thursday through the California Nurses Association, criticizing the federal government for not adequately managing the crisis. As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick and in quarantine after caring for a patient who tested positive. I'm awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered it.
Gavin Newsom earlier in the week declared a state of emergency for California to free up additional state and federal resources to fight the virus. The cities of Los Angeles and San Francisco have also made emergency declarations.
Officials said they were anticipating economic consequences from the loss of tourism and the prospect of restaurants and other businesses seeing sharp drops in business as they have in other parts of the world affected by the virus. In Santa Clara County, home to most of Silicon Valley, where there have been at least 20 cases, officials were proposing an urgent ordinance to stop families from being evicted should there be business closures or layoffs.
Tests from the cruise ship have been eagerly awaited since the governor's announcement earlier this week that 11 passengers and 10 crew members on the ship had been showing flu-like symptoms. On Thursday, officials flew test kits to the ship by helicopter and collected samples from about 45 people.
Thousands of passengers had been isolated in their cabins, waiting for word.
To pass the time, Denise Stoneham, 52, said she and her husband had been watching back-to-back movies. Several times a day, crew staff members wearing masks slide a tray of food into their room, she said, acting as if everyone on board is infected. She said neither she nor her husband has any symptoms of the virus.
After learning that there were cases on board, Mrs. Stoneham, a code enforcement officer from Novato, Calif, said she tried to calm herself down by sitting on her balcony and taking in the fresh air. The moment captured a feeling she expressed earlier in the day, "We're in a jail cell but on sea."
Thomas Fuller reported from San Francisco, Sarah Mervosh and Jenny Gross from New York, and Tim Arango from Los Angeles.